Do you ever notice sudden weakness on one side, trouble speaking, or a face that feels off when you smile? What if those quiet warning signs were your body asking for help, and you could act before serious damage happens? What if you knew exactly what to do in those first critical minutes? Today we'll cover what a stroke is, the warning signs that may appear, why fast action matters, common risk factors, lifestyle habits that may support stroke prevention, and what to do if you suspect a stroke. Here's a question for you. When was the last time you checked your blood pressure or asked your clinician about your stroke risk? This guide is designed for general adults, caregivers, and anyone curious about stroke awareness. This content is for educational and informational purposes only and is not medical advice. Always consult a qualified healthcare professional regarding health concerns. Have you ever wondered what actually happens in your brain during a stroke? A stroke happens when blood flow to part of the brain is blocked or when a blood vessel in the brain bursts. When blood flow is blocked, it's called an ischemic stroke. When a blood vessel bursts, it's called a hemorrhagic stroke. There's also a temporary blockage called a transient ischemic attack, sometimes called a mini stroke. Transient ischemic attacks are warning signs that a larger stroke may happen later. Strokes can cause sudden changes in movement, speech, vision, or balance. Over time, stroke may affect memory, mood, and daily function. Here's something to think about. Could knowing the difference between these types help you or a loved one get the right care faster? Understanding what a stroke is helps you recognize warning signs and take thoughtful steps for prevention. What if you could spot a stroke in under 30 seconds? Warning signs of stroke can happen suddenly. A simple way to remember is balance, eyes, face, arms, speech, time. Balance means sudden loss of balance or coordination. Eyes means sudden trouble seeing in one or both eyes. Face means one side of the face may droop when you smile. Arms means one arm may feel weak or numb when you raise both. Speech means speech may be slurred or hard to understand. Time means time to call emergency services right away. Other signs may include sudden severe headache, confusion, trouble walking, or dizziness. Here's a question. If you saw these signs in someone you love, would you know what to do? These signs can have other causes, but if they happen suddenly, treat them as possible stroke. If you notice these signs, call emergency services immediately. Do not wait to see if symptoms go away. What if every minute you waited cost your brain thousands of cells? Time is brain. When a stroke happens, brain cells start to die within minutes. Fast treatment can limit damage and improve recovery chances. For ischemic stroke, a clot-busting medication may be given if given within a specific time window. In some cases, a procedure to remove the clot may be options. For hemorrhagic stroke, controlling bleeding and reducing pressure in the brain may be needed. Every minute counts. Calling emergency services quickly can open doors to treatments that may not be available later. Here's something important. Even if symptoms seem to go away, get medical help right away. It could be a transient ischemic attack, which is a strong warning for a future stroke. Would you risk waiting to see if it gets better? Have you ever wondered why some strokes are treatable with medication while others need surgery? Ischemic stroke is the most common type. It happens when a blood clot blocks blood flow to part of the brain. Causes include hardened arteries, irregular heart rhythm, or small vessel disease. Hemorrhagic stroke happens when a blood vessel in the brain bursts. Causes include high blood pressure, weakened blood vessel walls, or abnormal blood vessel connections. Transient ischemic attack is a temporary blockage that causes stroke-like symptoms that go away within minutes to hours. Transient ischemic attack is a warning sign that a larger stroke may happen soon. Here's a question. Did you know a mini stroke is actually a red flag for a bigger one? Each type needs different evaluation and treatment. Understanding the type helps clinicians choose the right care plan. What if you could reduce your stroke risk before symptoms ever appear? Some risk factors for stroke can't be changed, like age, family history, and certain ethnicities. Risk increases with older age, family history of stroke, and being of certain ethnic backgrounds. Other risk factors can be managed. These include high blood pressure, diabetes, high cholesterol, irregular heart rhythm, smoking, obesity, physical inactivity, unhealthy diet, and excessive alcohol use. Sleep apnea and chronic kidney disease may also increase risk. Here's something to consider. How many of these risk factors do you have? Managing these factors may help reduce stroke risk over time. Regular checkups and monitoring are important, especially if you have multiple risk factors. Did you know high blood pressure is called the silent killer because it often has no symptoms? High blood pressure is the leading controllable risk factor for stroke. Over time, high pressure can damage blood vessels in the brain and increase the risk of both ischemic and hemorrhagic stroke. Many people don't notice high blood pressure until problems appear. Regular blood pressure checks can help identify changes early. Working with a clinician to manage blood pressure through lifestyle and medications may help reduce stroke risk. Here's a question: when was your last blood pressure check? If you have high blood pressure, follow your clinician's guidance on diet, activity, and medications. Small, consistent habits often support general wellness over time. What if managing your blood sugar and cholesterol could protect your brain too? Diabetes can damage blood vessels over time and increase stroke risk. Managing blood sugar levels may help protect blood vessels and reduce risk. High cholesterol can lead to plaque buildup in arteries, including those that supply the brain. This plaque can narrow blood vessels or break off and cause blockages. Lifestyle habits and medications may help manage cholesterol. Here's something to think about: are your recent lab results showing what you hope? If you have diabetes or high cholesterol, work with your clinician on a plan that fits your health. Regular monitoring and follow-up are important. Have you ever felt your heart skip a beat or race unexpectedly? Irregular heart rhythm, also called atrial fibrillation, is an irregular heart rhythm that can cause blood clots to form in the heart. These clots can travel to the brain and cause stroke. People with irregular heart rhythm may have a higher stroke risk. Blood thinning medications may be recommended to reduce this risk. Here's a question: if you felt your heart racing right now, would you know what to do? If you feel your heart racing, skipping beats, or feel short of breath, check with a qualified healthcare professional. Early diagnosis and treatment of irregular heart rhythm may help reduce stroke risk. What if small daily choices could protect your brain for years to come? Some people find these habits supportive for stroke prevention. Eat a balanced diet rich in vegetables, fruits, whole grains, and lean proteins. Limit excess sodium, saturated fats, and added sugars. Stay physically active with regular movement like walking or cycling. Maintain a healthy weight. Avoid smoking and limit alcohol. Manage stress through relaxation, sleep, and social connection, and get regular checkups. Here's something to consider: which one habit could you start this week? If you have sleep apnea, treating it may help reduce stroke risk. Talk with a healthcare professional before making major changes, especially if you have existing health conditions or are on medications. Small, consistent habits often support general wellness over time. What if your next meal could help protect your brain? Diet plays a key role in stroke prevention. A plant-forward diet like the DASH eating plan or Mediterranean-style eating may support heart and brain health. Focus on vegetables, fruits, whole grains, legumes, nuts, and healthy fats like olive oil. Limit processed foods, red meat, sugary drinks, and excess salt. Staying hydrated is important. Here's a question: what's one healthy swap you could make at your next meal? If you have high blood pressure or kidney issues, ask your clinician about sodium and protein goals. Balanced eating with appropriate portions may help support healthy blood pressure and cholesterol levels. What if just 30 minutes of walking could lower your stroke risk? Regular physical activity may help reduce stroke risk. Aim for at least 150 minutes of moderate activity per week, like brisk walking, cycling, or swimming. Add strength training twice per week if possible. If you're new to exercise, start slow and build up gradually. Move gently after meals, take the stairs, and find activities you enjoy. Here's something to think about: what activity could you do today that your future self would thank you for? If you have health conditions, check with a qualified healthcare professional before starting a new exercise plan. Consistent movement over time supports heart, brain, and overall health. What if quitting smoking could start reversing your stroke risk today? Smoking damages blood vessels and increases stroke risk. Quitting smoking may help reduce risk over time. Support from clinicians, nicotine replacement, or counseling may help. Alcohol in excess may increase blood pressure and stroke risk. Limit alcohol to moderate levels if you choose to drink. Here's a question: what's one small step you could take this week toward healthier habits? If you struggle with alcohol use, talk with a healthcare professional for support. Small changes in these habits may help support long-term health. What if recovery after stroke was a journey with small wins along the way? Recovery after stroke varies by person. Some people recover quickly, others need longer support. Rehabilitation may include physical therapy, occupational therapy, and speech therapy. These therapies help rebuild movement, daily skills, and communication. Mood changes like depression or anxiety are common after stroke. Support from clinicians and mental health professionals may help. Family and caregiver support is important. Here's something hopeful: progress may happen over months or years, and every step counts. Recovery is a process, and progress may happen over months or years. Stay connected with your care team and celebrate small wins. If stroke happened to someone you love right now, would you know exactly what to do? If you suspect a stroke, call emergency services immediately. Note the time symptoms started. This helps clinicians decide treatment options. Do not drive yourself to the hospital. Let emergency services handle transport. Stay calm and keep the person safe while waiting. If the person is unconscious, place them on their side. Do not give food, drink, or medications unless instructed by emergency personnel. Here's something critical. Early treatment can make a big difference. Even if symptoms go away, get medical help right away. It could be a transient ischemic attack. For reliable information, consider sources like the American Stroke Association, National Stroke Association, World Health Organization, or local health services. Local support groups and caregiver resources can help with practical questions about recovery and daily living. If this was helpful, subscribe for more clear, evidence-aligned health education. Share this with someone who may find it useful, a family member, friend, or caregiver. Your brain depends on steady blood flow. Understanding stroke warning signs and prevention steps can help you take thoughtful, informed steps for your health. This content is for educational and informational purposes only and is not medical advice. Always consult a qualified healthcare professional regarding health concerns.